Okay, Paramedic Captain Roland Berg. First of all, tell us what is Ebola?
Ebola is a virus disease that is basically coming out of West Africa. There are certain countries that have an outbreak of Ebola. It's not the entire continent of Africa, it's certain areas that have a high number of incidents of Ebola virus disease and stuff. Ebola is a disease that is transmitted by contact, direct contact with body fluids from a patient who is infected and showing signs and symptoms of the disease. It is not airborne at this time that we realize. It has to be direct contact, and we're talking about blood, urine, sweat, some respiratory fluids, and also feces. So you have to have direct contact with those substances, and then those substances then have to get into your mucous membranes in order for you to get infected with the disease. If a patient is not showing signs and symptoms of Ebola-like disease, then they're not infectious.
Okay, what are some of the symptoms of Ebola?
Right now on the CDC's webpage, they say that the signs and symptoms of a person exhibiting the Ebola-like illness are high fever above 101, nausea, vomiting, diarrhea, and aches and pains, and as well as a severe headache. Those are what is symptomatic for the disease.
Okay. Describe what the chances are of someone contracting the disease.
The chances of you contacting the disease is very slim. You have to have contact with a person that is infected with the disease, is showing signs and symptoms of the disease, and then get their body fluids on you. Just being in the area where somebody is not enough for you to get infected. Now again, there are very few people in this country who have been exposed to somebody with Ebola, that's symptomatic, and that have actually contacted the disease. There have only been 2 healthcare providers in the country who have come in contact with somebody and then became infectious. You are more likely to be in a car accident, you're more likely to catch the flu than you are of catching Ebola and becoming infectious.
Okay, if someone is experiencing these symptoms and they call 911, what should they expect?
In Prince George's County, we have instituted a policy at the advice of the state agencies of Maryland Institute of Emergency Medical Services Systems and the Department of Health and Mental Hygiene. The 911 call taker will ask you a series of questions, just like they do whenever you call 911, whether you're sick, having a heart attack, you have a house fire, or you have a car accident. They're going to ask you a series of questions so that they can determine what resources to send to your house or to your incident so they can take care of you properly. Now, if you are reporting that you are having a fever, that you're having nausea and vomiting, that you're having diarrhea, or that you're having basically flu-like symptoms or Ebola-like symptoms, they're going to ask you a couple more questions. This is to make sure that they can send the correct resources to your house and be able to take care of you appropriately. They're not trying to limit care. They're not trying to persuade you not to call 911. They just want to make sure that we send the right people to your incident so that we can provide the right care.
What will the paramedics be wearing when they enter a home that the patient is suspected of Ebola?
If the 911 call taker gets all the information and the suspicion is high for somebody having possibly an Ebola exposure or Ebola infection, they're going to notify the first responders prior to their arrival. Upon their arrival, they're going to come and they're going to dress in infection control material, which will involve a gown, glasses, a face mask, goggles, and appropriate other material. It is not meant to scare you. It is meant to basically ensure that they are protected and that you are also protected. Again, they're still going to provide the same care that they would for any patient. Just because you have a suspicion of Ebola does not mean that you have Ebola. It just means that we're going to take precautions to protect everybody. And then we're going to still treat you and transport you to the hospital.
Before you transport, you're going to consult with physicians about what you have.
That is correct. One of the things that paramedics and EMTs do on the ambulances in this county is every time we do a transport to the hospital, we do a medical consultation with the hospital. We speak with the hospital. We tell them what we are transporting to their facility. We ask them if they have any recommendations or medical orders that they want us to carry out en route to the hospital. With these suspicious patients that might have Ebola-like symptoms, we're going to tell them that what we are seeing, what we have found, and what is going on. They're going to then give us some feedback of what they would like us to do, such as stay outside the ambulance bay, do not bring the patient in until we come out and evaluate the patient to determine what resources the hospital needs to deploy so that they can take care of the patient appropriately.
Is there a website or phone number someone can use to get more information on Ebola?
Yes, we recommend that you go to the CDC website, and that is www.cdc.gov. It has all kinds of information for both the public, for first responders, for healthcare providers, for hospitals. Getting the information is what you need to do in order to be sure that you're not buying into the hysteria that is on the internet in various chat rooms. That is the most inappropriate thing to do, is to read what's going on online. Go to the subject matter experts, such as the CDC. They have experience in infectious disease. They have been dealing with this from the get-go. They know what they're doing with this stuff. So this is where we need to get our information from, not from some chat line or chat room.
Okay, any additional staying healthy tips that you can provide?
The Prince George's County Fire EMS Department recommends that everybody gets their flu season on an annual basis. It's not too late to get your flu shot, and we recommend you get that now so that you have enough time to develop the antibodies, so when flu season is in full swing later on in the month of December, January, and February, you'll be protected from it. It's safe, it's effective, and that is the best thing that you can do. You're more likely to catch the flu than get exposed or catch the Ebola virus. And more people die from the flu than they have done from the Ebola virus. So we recommend get your flu shot and practice good hand washing. That is the two things that'll help keep you safe and keep you healthy during the flu season.
All right, good. That's what I needed.
Okay,
Yep.
got it?